Most of us think of cardiovascular disease primarily in the terms of heart attack and stroke, which are definitely very common killers associated with cardiovascular disease. But basically, it means anything related to the heart or the blood vessels. So that can be things like heart rhythm problems, problems with the structure of your heart or your blood vessels, or if you take it even more broadly, it can include anything that just injures the blood vessels. So that can be things like diabetes, heavy metals, and things like that. It's kind of informally part of it, in the sense that if you have diabetes, you will inevitably have blood vessel damage and heart disease as a consequence of that. So a lot of the times it's kind of, as disease progress, they affect the cardiovascular system, and so you end up developing a lot of these issues. So if controlled, it's not a cardiovascular disease, and if left uncontrolled, it can become part of the picture. Sometimes it is very much out of your control, so those will be things that develop at birth. So that'll be things like holes in the heart, problems with your valves structurally, or you are just genetically kind of at a disadvantage. But most of the time, it is a product of lifestyle. In fact, cardiovascular disease is considered to be 80% preventable. So it's a matter of all of the different things we do that put strain on our heart and damage our blood vessels. So that can be things that we're eating. So high blood sugars is definitely the number one cause of that. But sometimes we have things like pesticides and heavy metals that sneak their way into our consumed products like food and water. Or it can be high stress, like our blood vessels respond to our nervous system. So if we are in a chronic stress state, then it's going to be really hard on our heart and our blood vessels, and eventually lead to some damage. It's very broad, to be honest. There's a lot.